My name is Cali. I'm a student nurse at Indiana State University. I'm going to be doing a complete head-to-toe assessment on you today. And can you tell me your name?
Keisha Down.
And your date of birth?
August 30th.
And where are you today?
I'm at Atlanta Dermatology.
Okay. And I'm going to tell you 3 words, and then I want you to repeat them back to me, and I'll ask you what those 3 words are later on. Cat, ball, and shoe.
Cat, ball, shoe.
Perfect. Alright, so her speech is fluent and clear in an even pace. She appears to be her reported age. Her appearance is clean and well groomed. Her facial features are all symmetric and equal. Her walk as she came in the door was even and coordinated and smooth. She needed no assistive devices or any assistance. She has full mobility of her joints. She maintains good eye contact. She is pleasant and her speech is fluent, clear, and even. She is well-groomed. Her clothing fits appropriately and is appropriate for the temperature, the situation, and her age and culture. Now I'm going to assess the skin. So the skin is intact. It is even in pigmentation. There are no lesions or bruises, and it is warm to palpation. The nails are clean and intact, and there are no signs of clubbing. The calf refill is less than 2. The nail adheres to the bed and is firm to palpation. The scalp is even and appears to be intact. No lesions, lumps, bumps, or infestations, and her hair is thick and is clean. The distribution is even for hair, including her eyebrows and eyelashes. And there are no signs of alopecia and abnormalities of her hair. And her face is round and symmetric, and I'm going to ask you to do a few things for me, okay? Alright, so clench your teeth and smile. Squeeze your eyes together. Perfect. And wrinkle your forehead. Stick your tongue out and puff your cheeks. Alright, and that's also testing the cranial nerve number 5 and number 7, which they are both sensory and motor. And then I'm going to take a cotton ball and test sensation. Alright, close your eyes for me. Alright, and then when you feel the sensation, let me know, okay?
Okay. Feel something. Feel something again. Anyway.
Okay, perfect. So then that's cranial number 5 also, which is light touch sensation. And then her eyes, her lids are intact, her eyelashes, eyelids, her eyebrows, the hair all intact even, and eyelashes are outward. The hair distribution of the eyelashes and eyebrows are even. And the sclera is white. The conjunctiva is pink and moist. And the cornea and iris are noted and even symmetric. And so I'm going to shine a light in your eye, okay? Okay. Alright. So this will test direct and consensual lighting. Alright, so just look at me, and then they constrict when the light is shined directly in the eye. It constricts, and then directly in the eye it constricts, and then both eyes constrict, and then both pupils constrict. So they are equal to the pupillary response and the corneal light reflex. Also, I noted that the reflection, which was the corneal light reflex, was symmetric, and I could see both the reflection. And I'm going to test your extraocular movements. Alright, so you're going to follow my feet. finger, and if you feel like you're gonna fall over, it makes you dizzy, just let me know, okay? Alright, so just follow my finger. Alright, so that tests the cranial nerves 3, 4, and 6, which are all motor movements. And it's all intact, and she's able to follow my finger. And then next I'm going to test for the confrontation fields, which will be for peripheral vision. And this will test the cranial nerve number 3, which is a motor movement. Okay. Alright, so just look at me, and then tell me when you can see my fingers.
I can see.
Okay. And then now?
I can see.
Okay. And then I can see. Okay, perfect. So her peripheral vision is intact. And now we're going to go to the ears. So I'm going to look in your ear, and then first I'm going to palpate the ear to make sure that there's no tenderness or any pain, anything. No, perfect. Alright, so we'll grab my otoscope. Alright, I'm going to pull up and then look in. Alright, so there was no drainage, and the tympanic membrane was intact, no redness or any pain with that inspection. And then I'm going to do a test for hearing, and I want you to cover this ear. And I'm going to whisper a word, and you just tell me what it is, okay?
Cat.
Yes. Now cover this ear. Okay.
Dog.
Yes. Alright, so then I am going to use this tool.
Okay.
And then I'm going to hit it, and then I'm going to place it on top of your head, and then I want you to tell me whenever you stop feeling the vibration, okay? And then I'm going to put it to your ear, and then I want you to tell me when you stop hearing the vibration.
Stop. Stop.
Alright, so your hearing is intact. And then I'm going to look at the nose. So the nose is midline, and it appears to have no deviation or any kind of lumps, bumps, bruises, or anything like that on the outside. And let's see. Alright, I'm going to have you tilt your head back. Perfect. Alright. So there are no lesions, no bumps on the inside, and the termites are intact and pink in color, and there's no redness. The septum is not deviated. And now I'm going to have you take one finger and place it over your nose. Now breathe inward with the other one. Perfect. And then take your finger to the other. Okay, perfect. Alright, so there are no obstructions in her nose either. And next I'm going to do the mouth, and I'm just going to look, and then her lips are moist, there are no cracks, no lesions, and then I'm going to have you open your mouth. Alright, so all the teeth are intact, and keep your mouth open. I'm sorry. Her tongue is rough on the upper side of it, and then her mouth, there are no lesions or any kind of grossness. Alright, so I am going to now put on gloves, and gonna palpate your lips. Any pain or tenderness? Any pain or tenderness? Alright, and then stick out your tongue. Perfect. Alright, any pain or tenderness? Okay. And then I'm going to look at the roof of your mouth. Alright, so everything is intact for the hard palate and the soft palate. And then I'm going to look underneath your tongue. Perfect. So no lesions, no masses, no bumps. And then I'm going to look at the back of your throat. Have your tongue down. Hold on. And say okay. So the uvula is midline and rises, and midline on pronation. And so that is the cranial nerve number 12, and that's the motor movement. Take off my glove. Alright, so next I'm going to inspect your neck, and there appears to be no lumps, no bruises, no masses or anything like that. Everything is symmetrical. The eyelid appears to be, the trachea appears to be in the midline. Next, I'm going to palpate your trachea. This might be a little bit uncomfortable, but if it is, just tell me to stop. Okay? Oops. Alright. So everything is midline and intact, and there's no pain with palpation. Next, I'm going to have you do a little bit of exercises for me. Alright, so I'm going to place my hands on your shoulders, and I want you to shrug. And then push down, and then perfect. Alright, so that would test for the cranial number 11. And that's the shrug test. Next, I'm going to palpate your lymph nodes, and that might be a little bit uncomfortable, but if it is, let me know. Okay? Alright, so this is going to be your your pre-auricular, and then behind is going to be your post, and then your occipital, and then down here is going to be your deep cervical. Alright, and then this is your submental, and then your mandibular, submandibular, and your submental, and then your superficial cervical, and then your deep cervical, and then kind of show your shoulders up like that. Alright, perfect. And that is your deep clavicular. And then your post deep cervical. Okay, and then I am going to inspect your reflexes. Alright, so let's see. I'm going to raise this up. Alright, so just relax your hand. Perfect. And then, alright. No pain with that, right? No. Okay, perfect. So your reflexes of your arm and your elbow are intact. And now I'm going to do your knee. Perfect, so those are intact also. Alright, and then I am going to inspect your back and listen to your lungs, okay? Okay. So I'm going to have you just swing that way a little bit. Perfect. Alright, so the skin on the back is uniform with the rest of the proper skin. There are no lesions, no bumps, no masses. And then I'm going to alright, so first I'm going to palpate for even chest rise symmetry. Alright, go ahead and take a deep breath in. Alright, let it out. So the chest rises and falls symmetrically. And next is going to be the tactile firmness. And so I'm going to put my hand here, and then I want you to say the words 99.
99. 99. 99. 99.
Perfect. Alright, and the A&P diameter is 1 to 2, and then I'm going to percuss, and so there was resonance percussion of the upper chest. Now I'm going to listen to the lungs. Alright, take a deep breath. Let it out. Deep breath. And deep breath. And then one more. And let it out. Perfect. Alright. And then I'm going to place my hand here, and then I'm going to hit it, and then you tell me if there is any pain or tenderness, okay?
Okay.
Pain or tenderness?
Mm-hmm.
Pain or tenderness?
Mm-hmm.
Alright, so the CVA is no tenderness or discomfort with that. And now I'm going to listen to your heart. The sounds that I heard with the lungs are going to be the bronchial here, the vestibular in the midline, and then the vestibular on the outside for your lungs. Mm-hmm. And then now I'm going to just look at your chest and look for symmetry and do your respirations and stuff like that, okay?
Okay.
Alright, first I'm going to actually check your pulse. Alright, so that is going to be normal and even rhythm with a pulse rate of about 72. Mm-hmm. And then it's not bounding or anything, so 2 plus. And then I will ask you to rest back. Mm-hmm. Perfect. So, alright, so actually, there we go. Alright, so the skin on the interior part of the chest is within the shades of the rest of her body. It is even in pigmentation. Symmetry is even. It rises and falls together, and the respirations are even and unlabored at 16 breaths per minute. And they're, like I said, even in the unlabored. No heaves, no lifts, no pulsations. The chest wall is intact, and there is no tenderness or crepitation. I'm going to listen to your heart now. Alright, so I'm just going to hold this down right here. Mm-hmm. And then I'm listening for the aortic. into the herbs. And with the bell. And the mitral valve. The tricuspid valve. And then with the bell. And then the mitral valve. And then with the bell. Alright. So with the aortic valve, I heard the S2 is louder than S1, and the pulmonic valve, the S2 was louder than S1. Herbs is about equal to S1 and S2. The tricuspid valve, S1 is heard louder than S2, and the mitral valve is heard. S1 is heard louder with the mitral valve than the S2. There were no extra sounds, no S3s or S4s. The lungs on the anterior. There you go. Alright, and then deep breath. Let it out. Deep breath. And let it out. Perfect. And no Adventist sounds heard for that either. And then I'm going to listen to your carotid. And then I'm going to have you lift your neck up a little bit. Perfect. Alright. And then take a deep breath in and hold it. Okay. And then I'm going to palpate your carotid arteries, which they are equal. Next, we're going to go to the neurologic part of this, and then I'm going to do some tests on you, okay? Alright, so the sensory function test is going to test for dull or sharp pains, and then move on to some other tests, okay? Alright, so I'm going to use this cotton again, and this is going to be for light touch, okay? Okay, close your eyes for me, and then tell me when you can feel this, okay? Okay. I feel it. I feel it, okay. Yep. There it is. And then, can I open my eyes? I'm going to let your hands leg up. I feel it. There it is. I'm taking your gloves off. Okay. Yep. Yep. Okay. Alright, so the sensory function for that is intact. And then next I'm going to use your palm. Alright, so I'm going to draw a number in there, and then you'll tell me what it is, okay? Close your eyes. 7. Yes. Alright, and then you can open your eyes and put your hand back down. Alright, and then we're going to do the, we'll just call it the rapid alternating movements. Okay, so you're going to take your fingers, and you're going to touch each finger on your thumb, and then you're going to do it reverse. Okay, do it. Okay, perfect. And then I am going to have you stand up. Right now? Yeah. Okay. Alright. Here's the right here. Okay. Alright. And then I'll have you close your eyes and put your feet together. Alright. Alright. Alright, so the Romberg test is negative. And you can have a seat. Oh. Thank you. Alright, and then I'm going to do another test with your fingers. Hold your hand out. Close your eyes. And you're going to tell me if your finger is up or down, okay? Up. also going to do it to your foot. Okay. All right, tell me your toe down.
Down.
All right. Perfect. All right. So, and then I'm going to now look at your abdomen, okay? All right. So I'm going to lift this up. Okay. And then I'm going to inspect the color, contour, and brain pulsations or abnormal movements. So everything rises and falls together. Everything is symmetric, and it is flat, and no pulsations or movements. And then I'm going to then listen to your vowel sounds. Okay. Mm-hmm. Vowel sounds are active in all 4 quadrants. I did not hear any abnormal sounds or birds. Now I'm going to percuss. If this is uncomfortable, just let me know. And next I'm going to just do a little bit of palpation, and if this is uncomfortable, just let me know. Okay. Any pain or tenderness? No. Any pain or tenderness? Pain or tenderness? Okay, and now I'm going to do it a little bit deeper, okay? No pain or tenderness? Pain or tenderness? Alright. So everything is within normal limits. Okay. And then I'm going to just look at the lower part of your body, okay? Okay. Alright. So the lower part of the body, the skin down here is intact, no lesions, no bumps, no bruises, no abnormal moles. And I'm going to assess for the pedal pulse. And they are equal. And then I'm going to do the home inside. And what I'm going to do is put your leg up like this. And then put it right. And then any pain? No. Same thing on the side. Any pain? No. Alright. So then I'm going to do the stand up. Okay. Alright, so I'm going to do the range of motion for your elbow and for your knee. So you can sit down. Alright, so I'm going to have you flex your arm and then put it back on. Okay, perfect. So your range of motion with those joints are within normal limits. And then I'm going to palpate the joint of the elbow. There's no edema, no warmness, and no crepitus. Then I'm going to have you test your strength of your muscles. And then what you're going to do is then push back towards me. Okay, and then opposite of pull towards you. Okay. So her muscle strength is a 5 on the grading scale, which is full resistance, full range of motion against resistant or gravity, and full resistance. And then I'm going to do the same thing for your knee. Okay? And the motions are flexion, and extension. I'm trying to combine those 2 words. Alright, so the joint at the knee is not warm, and it is not, there's no edema, and what I'm going to have you do is stand up, and then put your knee towards you, perfect, and push it down. Alright. stretching the outline. There is no allotment or bulging of the knee. Then I'm going to ask you what those 3 words were again.
Cat ball shoe.
So remote memory is intact.
Yes.
And thank you for your time today.
Thank you.